What is vaginal discharge? Vaginal discharge is a fluid that comes from the vagina. All women have it. It is a natural and essential part of the female reproductive system. It's how the vagina cleans itself. This self-cleansing mechanism is crucial for maintaining vaginal health and preventing infections. Discharge helps to remove old cells and keep the vagina healthy. It also helps to maintain the balance of good bacteria in the vagina, which is important for preventing infections. Think of it like this. Your mouth makes saliva. Saliva is a fluid that cleans your mouth and helps you digest food. Saliva is a fluid that cleans your mouth and helps you digest food. Vaginal discharge is similar. Just as saliva is essential for oral health, vaginal discharge is essential for vaginal health. Discharge is a normal part of being a woman. It is a sign that your body is functioning properly. The amount and type of discharge can change throughout your menstrual cycle. This is completely normal. Hormonal changes during the menstrual cycle can affect the consistency, color, and amount of discharge. For example, it may be thicker and more noticeable around ovulation. Understanding the different types of discharge can help you recognize what is normal for you and when you might need to see a healthcare provider. Normal discharge can range from clear to milky white and may have a mild odor. If you notice any significant changes in your discharge, such as a strong odor, unusual color, or discomfort, it is important to consult a healthcare provider. They can help determine if there is an underlying issue that needs to be addressed. Why do we have discharge? The vagina is like a self-cleaning oven. It needs to stay clean and at the right pH level. Discharge helps with this. Discharge is made up of fluids, cells, and bacteria. The good bacteria help to control the growth of harmful bacteria. This keeps the vagina healthy. Discharge also helps to keep the vagina lubricated. This is important for comfortable sex. Different types of discharge can tell you a lot about your health. Discharge can come in different colors and textures, each indicating something unique about your body. It can be clear, white, yellow, or slightly bloody, and each type has its own significance. The amount and type of discharge can change throughout your menstrual cycle, reflecting hormonal fluctuations. Clear and watery discharge is the most common type. It's often seen during ovulation and can increase after physical activities. It's normal to have more of this type of discharge after exercise or when you are ovulating, as your body is more active and producing more fluids. White and creamy discharge is also normal. This type is usually seen before and after your period, indicating the different phases of your cycle. Yellow or green discharge, however, can be a sign of an infection. This type of discharge is often accompanied by a foul smell or irritation. If you notice yellow or green discharge, it's important to see a doctor. Early diagnosis can help in effective treatment. It's important to remember that everyone is different. What is normal for one person may not be normal for another. Understanding your own body and its patterns can help you identify when something is off. Always consult a healthcare provider if you have concerns. Most of the time, vaginal discharge is normal. It plays a crucial role in keeping the vagina clean and preventing infections. The glands inside the vagina and cervix produce small amounts of fluid that flow out daily, carrying away dead cells and bacteria. This is a natural process that helps maintain a healthy vaginal environment. It's important to know the difference between normal discharge and discharge that could be a sign of a problem. Recognizing these differences can help you take better care of your health and seek medical advice when necessary. Normal discharge has a mild odor or no odor at all. It is usually clear or milky white and may vary in consistency throughout your menstrual cycle. It doesn't cause itching or burning. If you experience these symptoms, it could be a sign of an infection or other health issue. It is clear, white, or slightly yellow. The amount and consistency can change due to hormonal fluctuations, stress, or sexual arousal. Discharge that could be a sign of a problem has a strong, fishy odor. This could indicate bacterial vaginosis or another type of infection. It is green, gray, or foamy. These colors are not typical and should be checked by a healthcare provider. It causes itching, burning, or redness. These symptoms can be uncomfortable and may indicate an infection or other condition that needs treatment. It is thick, like cottage cheese. This type of discharge is often associated with yeast infections, which are common but treatable. If you are ever unsure about your discharge, it's always best to talk to your doctor. They can provide guidance, conduct tests if necessary, and recommend appropriate treatments to ensure your vaginal health is maintained. You should see a doctor if you have any of the following symptoms. A change in your discharge that worries you. Itching, burning, or redness around your vagina. Pain during sex. Bleeding between periods. These symptoms could be a sign of an infection or other problem. It's important to get checked out by a doctor to get the right treatment. Don't be afraid to talk to your doctor about your vaginal health. They are there to help you. Understanding your body is important. Pay attention to your discharge. Knowing what's normal for you can help you spot any changes early on. This can help you get treatment quickly if needed. Your vagina is a part of your body. Take care of it. And don't be afraid to ask your doctor any questions you have.